Today, medical science recognizes that some folks aren't helped by relaxing exercises. In cases of difficult tension and nervous apprehension, doctors are now prescribing medicine.
Jeff's losing control of himself.
Just drink this and you'll be fast asleep.
For decades, pharmaceutical companies have sought innovative and sometimes humorous ways to promote their miracle cures. But today, the selling has become as sophisticated as the science. The promotion of blockbusters Prozac, Paxil, and Zoloft has caused antidepressant sales to skyrocket, generating a $20 billion market.
I am diagnosed with panic disorder, and if I can do this and get up and become somebody else and make a difference in the world, so can you.
While many have been helped, there's a growing global controversy that the benefits of such drugs have been overblown, while rare but potentially deadly side effects have been played down.
The dramatic and severe symptoms that led to my daughter's suicide manifested only after she started taking antidepressant drugs.
These drugs are being prescribed like candy. They're being given for practically everything, it seems, today.
Modern life today is very stressful. Relieving those stresses would mean changing the way we live, work, and play, reshaping our cities and communities, and cleaning up the environment. Instead of redesigning our surroundings, it's a lot simpler to modify ourselves to fit the new conditions. Why not just take a pill? Today, there seem to be drugs for every problem, and pharmaceutical companies are huge and highly profitable. But in such a competitive area, health and well-being of people often take a back seat to profit. Medicines are just another business product. Tonight, a look at how pharmaceutical industries sell their products and some of the consequences. Leading psychiatrist David Healy supports medicines for those in genuine need. But he's rocked the scientific establishment with accusations that aggressive drug marketing is creating need, blurring the boundaries between medical conditions and ordinary life.
Now, there are scientific, political, and ethical issues involved here, but in psychiatry there's, of course, one more issue. The very way you understand yourself is involved here.
Paxil, also known as Aeropax and Seroxat, became the world's top-selling antidepressant only after its manufacturer started advertising a little-known condition called social anxiety disorder.
People with social anxiety disorder consider themselves extremely shy, uncomfortable meeting new people, uncomfortable being in situations where they may have to present themselves, like speaking in public, doing anything when other people are watching and there's the potential for you to say or do something to embarrass yourself.
As with the other antidepressants, almost all the key clinical trials of Paxil have been funded by the pharmaceutical industry. A paid consultant to 17 drug companies, including GlaxoSmithKline, the makers of Paxil, Murray Stein has worked on the main trials of the drug for social anxiety disorder.
People will choose jobs where they get to interact as little as possible with other people. So we see people with social anxiety disorder really accommodating the illness by becoming, librarians, accountants, computer programmers.
I was never originally like this. I was always a really outgoing person, liked to be the center of attention. Things started happening in my life. I lost one of my best friends, which is when I first started having panic attacks and anxiety attacks. And as the stress got worse, the panic attacks and the anxiety got worse. And as the stress went away, the panic attacks didn't go away.
Social anxiety disorder is, to me, it meant the fact that I just really could not work with the public without being quite nervous or quite anxious. Good morning, everybody. I have a hard time, even to this day, going to social functions. I was unemployed, and I found myself getting really nervous and agitated at job interviews. I would stutter when I spoke. Typing was difficult, and it seemed like every time I went on another interview, it got worse, and it got worse, and it got worse. Then I saw the commercials, and I thought, well, maybe this might help me.
Paxil, the only medication proven effective for social anxiety disorder, works to correct the
I started seeing the ads on TV for Paxil, and the ads summed up just what I was feeling.
What it is, what it feels like.
The one ad that really stood out for me was a gentleman that went out to a dinner party, I believe, and it showed it from his perspective, and everyone was looking at him, and I mean, you just got this vibe from this commercial, and that's exactly how I felt.
We know what social anxiety can feel like, and Paxil can help.
It took me a couple of months to get the guts to call the doctor. I went for an appointment and I explained to him what was going on, and before I even asked about Paxil, he suggested it to me.
I just walked into the physician's office and said, I think I have social anxiety disorder, and I heard of this medication called Paxil on television, and I'd like to try it. And he went ahead and filled the prescription. I pretty much diagnosed myself. He did not ask me any questions. He just filled the prescription that I wanted.
Paxil is non-habit forming.
I'm not bogged down by worry anymore. I feel like me again.
I did a study in doctors' offices, and what I found was if a patient had come in and they'd asked for an advertised medicine, 3/4 of the time they walked out of the doctor's office with a prescription for that specific brand.
These days, it's not just the drugs that are branded, it's also the diseases that go with them.
The thing is, the butterfly is one type of an image. The hummingbird is actually...
Vince Perry's firm designs advertising campaigns for drug companies, helping draw public attention to the latest disorders, a job he describes as condition branding.
It's a little bit overused.
Condition branding really creates new ideas about illnesses and conditions that are embraced by both patients and physicians.
So what's the idea behind the bridge structure then?
The bridge is a metaphor.
While drug companies might call it disease awareness raising, Perry's notion of branding a condition suggests industry might sometimes influence the very way conditions are being defined.
You need to create an idea, or you need to own an idea about the condition itself and the best way to define the condition. You need to own an idea about who that person is, how that patient or that profile of that individual manifests itself in the population.
Look at Fred. His feet are cold. His hands are hot. And Fred wishes he were someplace else. Diagnosis? Stage fright.
In the past, jitters, stage fright, inability to feel comfortable in a crowd, these were normally called shyness or extreme shyness or diffidence or other words. Most recently, and it's what we call social anxiety disorder.
Shyness is a very common personality trait. If you ask people in the general population, you ask 100 people, are you shy? About 1/3 of people will describe themselves that way. Social anxiety disorder can be thought of in some ways as being a real extreme of shyness. So if you took those 33 people out of 100 who said that I'm shy, probably 2 or 3 or 4 of those people would actually have shyness that interferes with their lives to the point that we'd say they have social anxiety disorder.
While there are differing views about how many people are affected by these conditions, companies often choose to promote the highest estimates. The maker of Paxil has claimed 1 in 8 people suffer from social anxiety disorder, which adds up to over 30 million Americans.
There is no sharp dividing line between somebody who